Hi everybody! My name is Ria Jo and I am currently a high school senior at Carey Academy. Today I'm here to share my paper on quantifying biopharma alliance fragility using a strategic shock risk index or SSRI. So this project began with a personal question. My grandmother was diagnosed with Parkinson's disease, and when I visited her last summer, I saw how it had transformed her once energetic spirit into daily struggle. Doing deeper digging, I learned that over 90% of drug candidates fail to reach the market. In fact, the American Society for Biochemistry estimates that it takes 10 to 15 years and around $1 billion in USD to develop one successful drug. So why is this? Well, science is one of the major problems, but the obstacle isn't just that, but it's also the business strategy needed to bring breakthroughs to the market. You see, strategic alliances serve as lifelines for biotech startups who often lack the resources to carry out clinical trials and bring therapies to the market. Thus, by partnering with pharmaceuticals, they can access these resources, while pharmaceuticals can simultaneously adopt novel technologies and remain competitive in the market. With that said, these alliances are inherently fragile. Premature terminations often occur due to trial setbacks and shifting portfolio priorities. As a result, early-stage companies are severely impacted. Stock prices crash, timelines slip, but worst of all, therapies are unable to reach the patients who need it most. Currently, there's no tool to assist early-stage companies in alliance management. That's why I developed the Strategic Shock Risk Index, a data-driven model that uses alliance characteristics to forecast the market shock of a terminated biopharma alliance. It serves as a risk thermometer for early-stage biotechs to monitor their alliances, with scores indicating whether they're facing a mild dip or a severe crash. This tool is important because it's one of the first quantitative frameworks to assist early-stage biotech companies in alliance management. In doing so, companies can manage them more effectively, ultimately speeding up the drug delivery process and ensuring therapies can reach patients like my grandmother. This work has been presented at the IEEE MIT Undergrad Research Conference and validated by global consultants and founders, as well as attendees of the BioFuture Investor Summit in October. To build the SSRI, I compiled a pilot dataset of 20 terminated alliances between 2014 and 2024, using SEC filings, press releases, and PubMed. For each deal, I extracted key features such as deal size, duration, phase of development, unilateral exit rights, which indicates whether one party can walk away freely, and concurrent alliances to measure portfolio diversification. I then standardized these features using min-max normalization before running a quadratic regression with interaction terms to account for nonlinear patterns. The dataset contained many related variables like duration and strategic fit, which all fall under the company's dependency on their partner, and prior terminations and concurrent alliances, which are all diversification factors. Therefore, I use principal component analysis to compress these related variables into a smaller set of summary scores, which include dependency and buffer subindices, to capture most of the variation. I then employed an embedded study with Python's library yfinance to build the target variable, which is the normalized abnormal return or NAR, because I needed a quantitative measure of market shock for each termination event. I first downloaded 60 days of stock prices for each early-stage biotech company and the S&P 500 around the termination date. I then computed the daily returns and abnormal returns. To get the cumulative abnormal return, I simply summed the abnormal returns for days t equals -1, 0, and +1 around announcement, and then I applied min-max normalization across these different quantities to compare across alliances with different volatilities. I then used ordinary least squares regression to build the actual SSRI, a predictive formula linking pre-termination features to the severity of the market shock. I set up the model to be NAR equal to individual features and subindices times their weights. I added interaction terms like duration squared and terms like duration times dependency to capture nonlinear effects. OLS was used to solve for the coefficients of each variable to minimize the sum of squared errors between the predicted and actual NAR. The output was the SSRI, an interpretable equation where each coefficient shows both the direction and the strength of the effect. Finally, I needed to measure the model's actual performance and fit, so I first used the R-squared metric to see how well my regression actually explains real-world variation in market reactions. I first computed the variation of actual NAR values around their mean, and then the variation of model errors, and then calculated R-squared using 1 minus residual variance over total variance. I also wanted to test if SSRI can really flag which alliances are high risk, so I employed a classification model called the ROC curve and measured the area under the curve to test this. I defined positive cases as painful alliances having an NAR greater than 0.75. To further evaluate the SSRI's ability to distinguish painful alliance terminations, I examined out-of-fold prediction SSRI scores, and while overlap remains, the distribution demonstrates discriminatory power within the limited data regime. As you can see, the model performed very strongly with R squared equal to 0.82, meaning we can explain over 80% of the variance in market shock. And the AUC equals 0.96, which means that 96% of the time, the model correctly ranks a high shock alliance above a low shock one. To evaluate the robustness of the -1 to +1 window, I recalculated the cumulative abnormal return under alternative window lengths and re-estimated SSRI using each variant as a dependent variable. Table 1 shows that SSRI retains a consistent ranking effect across specifications. The -1 to +1 and 0 to +1 windows yield the strongest fit, confirming that alliance fragility is most visible in immediate market reactions. Now you might be asking, why not use a 2-day window if the R squared is higher? Well, that improvement doesn't necessarily mean it's a better measure of market reach. Due to the shortness and asymmetrical nature of a 2-day window, it may miss part of the reaction if info leaks just before the announcement or exclude delayed reactions. Thus, the higher R squared likely reflects less noise from fewer days, and the 3-day window serves as the standard in finance research. To validate real-world predictive alignment, I created a heat map comparing predicted SSRI versus actual NAR. Results show strong diagonal alignment across the dataset, indicating consistent tracking of true post-termination shock responses. The outliers may reflect external shocks, delayed disclosures, or subsequent deal renegotiations. Now I'll discuss some feature insights and graphs derived from the SSRI model. Firstly, the histogram of predicted SSRI scores reveals a right-skewed distribution with most alliances clustered near moderate fragility levels. A few high-risk outliers marked by long durations, low buffers, and unilateral termination clauses appear in the upper tail, highlighting distinct pockets of vulnerability. Next, the scatter plot of the SSRI versus phase of development shows that early-stage alliances mostly have similar and moderate fragility, while later-stage alliances tend to be more spread out, which makes sense because late-stage deals involve more money and higher stakes, so investors react strongly when they break. Lastly, this 3D surface plot of duration times dependency shows that fragility peaks when alliances are long and moderately dependent. This makes sense because if dependency is extremely high, markets seem to already expect failure, so the shock is smaller. The significance of duration and duration squared suggests that longer alliances, which are typically viewed as stable, may amplify perceived risk, aligning with prior findings on time-dependent interfirm dependence by Hausler in 2012. The negative duration times dependency interaction reveals a subtle market logic. Visibly unbalanced and long-term deals may already be priced in by investors, muting termination shock. In contrast, the strong positive dependency times buffer effect shows that financial stability alone does not shield a startup from fragility. Operational overexposure, especially with high strategic reliance, still provokes severe market reactions, highlighting a blind spot in alliance design. And lastly, prior terminations and concurrent alliances counterintuitively reduce predicted shock. While these factors may suggest instability, the data points to a different interpretation. Experience with alliances and diversification may signal operational maturity and build investor confidence. Multiple active partnerships also reflect strategic agility and reduce perceived vulnerability. This tool has real-world implications. Founders can build smarter stage gates and reversion clauses into contracts, investors can price milestones more rationally and avoid hidden risks, and business development teams can design more resilient option-based multi-program deals. There are some limitations I would like to address. Firstly, the initial scope was limited to a small sample size of 20 alliances due to the difficulty of finding disclosed alliance terminations online. Secondly, while it accounted for nonlinear patterns and increased interpretability of results, the regression model is limited in accounting for the relationship between alliance characteristics and market shock. Finally, private alliance terms are often opaque and difficult to interpret, leading to potential inaccuracies in the dataset. So to address these problems, I've expanded the dataset to over 240 alliances with the help of Mark Edwards, founder of BioSciDB. I'm also incorporating richer firm-level buffers like portfolio concurrency and mining press releases and SEC filings for governance and strategic fit signals. Looking ahead, future iterations will incorporate real-time signals to enhance generalizability and may explore ensemble methods or semi-supervised clustering to capture more nuanced patterns. An additional extension involves developing a two-stage framework that predicts the likelihood of a line's termination, providing stakeholders with a more comprehensive tool. Overall, the SSRI is a first step toward predictive alliance risk modeling. By quantifying fragility, we can help companies avoid costly surprises and ultimately get therapies to patients faster. I would like to formally thank the IEEE ICDM Organizing Committee for hosting this conference and providing the opportunity to share my research. Additionally, I would like to thank Professor Christine Choi for her mentorship, and I am grateful to Dr. Anil Goyal, Linda Poland, and Mark Edwards for their advice and resources to support this project. Thank you for listening, and let me know if you have any questions.